Hi guys, so today we're going to talk about setting up a nursing staffing agency in the city of Toronto. Now, different cities in different countries have got their way and the process of being able to set a nursing staffing agency. Now, what's a nursing staffing agency? A nursing staffing agency is an agency that is equipped with lots of healthcare workers. Now, a healthcare staffing agency now has to do with lots of healthcare workers, nurses, PSW, healthcare aides, medical doctors, and laboratory technologists. Each and every one of them are all healthcare workers. So an agency recruiting such kind of people and supplies those staffs to hospital facilities, long-term care facilities, and healthcare facilities in any place, region. Those agencies are called healthcare staffing agencies. Now, some agencies also recruit workers from different walks of life, but they might not be in the healthcare setting. Now, there used to be lots of agencies in Mississauga in Ontario, and also in Brampton in Ontario. If you go to Brampton, Ontario, you're going to see lots and lots of agencies that give factory work, that give still same PSW, where there are agencies that supply workers for fast food industries and supply chains companies as well. So today we're just speaking about the healthcare staffing agency. And now the reason it's usually acronymed or more called nursing agencies, because there are usually more nurses in most healthcare agency for the facilities than the physicians, the laboratory technologies, and so on and so forth. Now, first step, let's start with step one. Step one is, should you want to be able to start a healthcare staffing agency in Canada or in Ontario? Here are some steps you're going to want to think about before the process. Number one is you're going to make a research and you're going to plan your business. Now, you have to understand the industry. You now need to have your target clients, which are hospitals, long-term care facilities, retirement residencies, private clinics, and home care agencies. Now, another industry you need to understand is the staff roles. So there are two. You're understanding, number one, the target clients, which are the people that are going to give you contracts. The people giving you contracts are your target clients, because without the contracts, your nurses have no place to go to work. So the target clients are hospitals, long-term care homes, retirement residents, private clinics, and home care agencies. Now we go into you understanding the staffs, the people you're going to be recruiting, the people you're going to be adding to your agency. Now, those people now have to do with registered nurses, registered practical nurses, which are RPNs, personal support workers, PSWs, nurse aides, and more. So after each of these time, you sit down, you think, you meditate about, okay, there is a staff part and there is a client part. Then you can now start preparing your business plan. In your business plan, you now have to include your services offered, what makes you more unique than every other healthcare staffing agency that has ever existed, or that is currently in trend, or that is currently getting all the clients and all the contracts. What's making you more unique? Now, what's your target market? Is your target market just in the city? Are you just thinking about Toronto, Mississauga, Brampton, or are you thinking about suburbs like Markham? Are you thinking about suburbs like you going to places like Thunder Bay, Ontario, or you going to Newfoundland and Labrador, or going to Halifax? So what's your target market? Then your pricing model. What's the price? What price are you giving to healthcare facilities to make them want to pick you and stay with you? What is the process, the procedure, the structures you've got that is way better than all the structures that makes you actually stay as the number one healthcare staffing agency people, companies, facilities should subscribe to. Now, you also need to think about your staffing structure. And after your staffing structure, you have to think about your marketing structure. And you also need to think about the financial projections. Now, all of these things I have actually named. Number one, services offered, your target market, pricing model, staffing structure, marketing strategy, financial projections. All of these are things you need to take into cognizance when you're setting up your business plan. Now, afterwards, when you have had all of that written out and well planned and well thought about, then you can decide to register your business in Ontario. You can decide to register the business as a sole proprietorship. If you have a friend who is a nurse, or your fellow nurse, or your fellow colleague that's willing to share same idea and goals with you, then you can also join partnership with them. And also you can register it as a corporation, whichever way you want. Then you have to search for the name, and when you search for the name, you have to go online to the registry and make sure that there is no name that has existed before prior to the name you're actually choosing. I remember when we started ours, there were so many names I actually had for it. And we had Oasis Healthcare, there was Oasis Healthcare Staffing Solution, there was Oasis Healthcare Staffing, but there were so many. So at the end, we ended it up with Oasis Care Staffing. Then my partner named it, my partner then had another name that came with it. So what I'm trying to say is you got to pick the right name, and also you've got to also pick a name that you could use on your website, because people are going to apply on your website, people are going to ask you on your website, they're going to reach out to you on your website. So your website doesn't have to be something long, or let's say you want to say Jane Nursing Healthcare Staffing. It might be too long of an acronym to put out there on a website domain. So all of those things that you need to factor into consideration. Then you need to register the business. You could use owner.com, the very, very good website that you can register your business at. Register for a business number with the Canada Revenue Agency. Owner.com, they do everything with you for you, and they even give you $300 with RBC. Don't tell anyone I told you that, but owner.com is the very good place to go. You get $300 starting your business with. Then you're going to get a proper license and insurance. Now, licensing and insurance is important because it depends on the environment or the community or the state or the province that you are currently about to operate. So you need to get a license there. No specific provincial license is required to run a staffing agency. Take note of that. But you must comply with Employment Standards Act, which is like a federal act, a Occupational Health and Safety Act, which is also like a federal act, WSIB registration mandatory for employers in Ontario, then Private Career Colleges Act. Now the insurance, you're also going to have to do a very, very small insurance, not a very, very serious insurance. You need to get coverage on general liabilities, professional liability in terms of malpractice and workers' compensation, and cyber security insurance. Now that's the beginning step. After that, now you need to go to building a talent pool, hire or contract nurses, PSWs, aides, ensure all certifications and licenses are valid. Make sure the CNO registration, the CPRO, and first aid certifications each nurse have is valid. They also have to do this criminal check, background check, reference verifications, and vaccinations in the cases it is required. Let's say if they're to be posted to a home care patient and the patient wants the person to be vaccinated from COVID or tuberculosis, then it definitely means the particular nurse or particular care aide that you're going to be posting from your agency over to the facility or to the home of the patient has to be vaccinated. That person also needs to have the food safety certificate to make sure if they're going to make food for the patient or do anything for the patient, they have the certifications and they are certified to be able to do so. Now, in terms of setting up operations, you can start from home. You don't need to get a big office to do any big stuff. You can start from home, and after you start from home, then later you grow up, there's many, you can decide to lease an office, and you register a virtual address, which you're going to do, and then your registration process, and have on your website as well. Then software tools, you need to scheduling software tools, timesheets for the nurses, like Shift Care. There are different types of apps for scheduling and time shifts. One of the apps is Shift Care. We also have Alaya Care, and we also have Home-Based Care. These are softwares that you need for scheduling and timesheets. Then we also have HRO and payroll. Then HRO and payroll, we have the softwares you're going to use for that, and it involves like the softwares like QuickBook, it's good for HRO and payroll, WagePoint, and Payworks. Then we also have the client and staff CRM. Client and staff CRM like Zoho, like Salesforce, and custom CRM can be able to work for you in terms of the software. Now, after you've gotten those software, now let's not forget that we've got two parts of the software. There's software for office, there's software for scheduling and timesheets, software for HRO and payroll, softwares for clients and staff CRM. Then the next step is for you to now go to finding clients and building partnerships. Now that is where the work is located. Finding clients and building partnership is something that is the major hub of the business, because without the clients you can't have work for the nurses, and without the nurses going to work, the company cannot be making money. So to that effect, finding clients and building partnership is very, very important. Number one, you need to invest in the marketing. What is the marketing? Marketing has to do with you getting a professional website. Send us a DM, leave a comment on the video. By the way, if you have not subscribed to our YouTube channel right now, we urge you to please subscribe to the YouTube channel. There are going to be more contents like this with different businesses and different models of operating different businesses that will be shared on our YouTube channel. So should you want to be able to get updated also with things from our blog, the Toronto House, Canada, you can find us on Instagram, on TikTok, on LinkedIn, on Pinterest. We are all on different social media. So should you want to also get updates about the news, things happening in the city of Toronto, things happening also around the world, things happening in different places, stay tuned, subscribe, follow us, and also follow our Instagram page, follow our Facebook page, follow our TikTok page as well, and you will be well informed. All right, now let's go back to the steps of building a healthcare staffing agency in Canada. Now, we're in the step of finding clients and partnerships. So you need to get a website. You can send us an email, or you could send us a message, or send us a DM in any of our social platforms, and we will be able to get you a website. Now, the importance of having your website being built by us is that we are a digital marketing company, and we also build a website and get to promote your website and promote your services and promote your products with us. On the blogs on TikTok, you would see your website and your services trending. On Instagram, in Toronto, in Canada, and even in the US, it will be trending everywhere over there. So we're saying the step of you getting a website, do not forget us. Now, after you get a website, you need to be able to have a Google profile about your business, that when people search online for your business, they will easily just be able to see your business, website, services, and everything. That is you having a Google profile. Now, we can also be able to do that for any business. Also, social media, especially LinkedIn and Instagram. Now, LinkedIn helps you for client acquisition, because there you can be able to see the managers, the supervisors of different healthcare staffing facilities, the doctors, the nurses. You can see a lot of them on LinkedIn. So you need to build a profile on LinkedIn, and you need to build a profile on TikTok, on Instagram, and even on YouTube as well. So it can be able to help your new business thrive and spread across different platforms, and people can call you. Healthcare facilities will call you, and also the nurses who are looking for a job will also be able to reach out to you. So the step of finding clients and building partnership is a step that you can't just sit down and tell your friends all in the living room or all around. You have to get a professional website, which we can help you do. You need to have a Google profile on your business that anyone can Google your business and it's up there, which we can also help you do. A social media platforms and accounts, we can also manage that and create that for you, as well as paid ads. Now, the paid ads is something most businesses fail on. Paid ads. Most businesses start their business, they have the profile, they have the website, they have the everything going, but they avoid the paid ads part. That paid ads part is what is like paying the real funder. So paid ads part is like paying the real funders of the digital world. It's like paying Google for Google ads. So when there is a YouTube video going on, and maybe the HR manager or the human resources manager of a company is just watching YouTube and seeing some beautiful sceneries, and there is an ad that pops up, and the ad that pops up is about your healthcare staffing business. And so putting that ad up on Google while YouTube is going on, for someone to be able to reach out to you and contact you, is what you're paying the ads for. Same thing happens with Facebook and also TikTok. TikTok also is very, very, very friendly right now with ads, and when you put ads up there, it can get to almost everyone in your local region, also spanning to countries like the US, also spanning to different countries and different people. So you could get someone who's about immigrating down to Canada, and while they're about to immigrate to Canada, they're finding about your nursing agency ad on TikTok, and they're sending you a message and telling you that I'm going to land in Toronto in October, and when I land, I'll be needing a job, and since I'll be needing a job, I'd like to come to your office and subscribe. And you definitely now have process structures to be able to work them on how to get the certification, so when they move down to Canada, you can easily get them to enroll for first aid, to enroll for CPRO, to enroll for the certificates and the trainings, and get their record checked and all that. And then afterwards, they become your staff, because your staff is working for the agency, and the agency is making money because it's got contracts with healthcare facilities around. Now, after you've done the marketing, which is the website, Google My Business, social media, and running of ads, then you got to do outreach, cold call or email retirement homes, hospitals, and clinics. You've got to do the cold call. Some of them are not going to come to you, some of them will not reply. You might even get no in some answers. You might hear, we only hire our direct staff. You might even hear, we don't allow third parties and all that. But you've got to keep the calls going on. Attend healthcare networking events. It happens a lot in Toronto, in Calgary, and British Columbia, in Vancouver, and British. Attend healthcare networking events. You can look online on your Google and you find that. Then offer promotional prizes or free trials. You can also offer promotional prizes and free trial shifts. Free trial shifts. If you give promotional prizes, could be like you deciding that you're going to charge the hospital or you're going to charge the healthcare facility for a very, very discounted price. or you could give them 2 free trials. Let's say there is a day they have a shortage because a particular nurse called in sick, and since the nurse called in sick, you picked up the phone and you said, okay, I've got a nurse that could fill the position, and the nurse actually goes there to fill the position. And when the nurse fills that particular position, you give it to them as a trial shift, and if they say that the nurse did well, then the next shift they want to book the nurse, then they get to get a contract or pay by the hour for that particular nurse. So now we've covered marketing and we've covered outreach. Outreach, we said cold call, attend healthcare conferences, offer promotional discounts, and as well as trial shifts. Now we're going to go to the next step, and the next step is understand legal and contractual obligations. You have to draft employment agreements and independent contractor agreements, use client service agreements, user client service agreement, outline hours, the rates, cancellations, liabilities, comply with privacy laws, and making sure your nurses are not sharing privacy of their patients out on social media, out to their friends and all that. Then you have to scale and optimize. You need to track your performance every 3 months. What have you done? How many contracts do you have in the first 3 months? How many nurses do you have in the first 3 months? What are the metrics? What are your fill rates? What's the satisfaction? Are the agencies satisfied? Are the people you've got contracts with, are they happy with the work that your nurses are doing or that your healthcare staff workers are doing? And expand to other provinces and see how it goes. So yeah, that was just a short rundown on how you could start a healthcare staffing agency in Canada and the province of Ontario. And I think it's usually almost the same thing with British Columbia and most other provinces as well. So yeah, if you have the idea, if you feel like you're a nurse and you're currently working with this set of people, and you know a high HRO that could give you a contract and all that, that's a good start. And by the way, if you need a job, or you are a healthcare staffing agency or the HRO or manager to a healthcare staffing agency, and you do need us, Oasis Healthcare Staffing, to provide you some viable nurses, or to provide you personal support worker, a healthcare aide, or to provide you a doctor or physician in our team, or even a lab tech in our team, we have our team equipped and we are ready to be able to send a support worker to you, a nurse to you, a physician to you, as quick as your request gets to our email. So keep us in mind. And don't forget to hit the subscribe button. If this video has been helpful to you, hit the like button. If this video has been helpful to you, please hit the like button, subscribe, and stay tuned for more content in the healthcare industry. Thank you. Bye-bye.